Thank you, sir. Today we are presenting Autism by Mr. P. Tirunagalinga Pandyan. Sir is working as a tutor in nursing at Madurai Medical College, Madurai. Sir has completed BSc Nursing at Madras Medical College, MSc in Child Health Nursing at Madurai Medical College, MA Sociology at Madurai Kamarja University, Madurai, Diploma in Pharmacy at Madurai Medical College, Diploma in Mental Health Nursing at Institute of Mental Health, Chennai. Sir has assisted as an operation theatre nurse for more than 1,000 brain and spine surgeries. Sir has entered into the government service on May 1999. Have a clinical experience of 15 years and teaching experience of 11 years. Sir having totally professional experience 26 years. Sir have written and published 2 textbooks for nursing students, textbook of psychology and sociology for nursing, textbook of pediatric nursing. Sir has done orally presentation regarding effectiveness of telemedicine counseling on reducing anxiety among COVID-19 positive patients at international conference held at Pondicherry, published nursing research paper at national and international nursing journal, and sir has actively participated in COVID-19 pandemic management activities and got COVID-19 Warrior Award. We are glad that we got chance to learn from the sir. Just a little housekeeping before we get start. If you have any question during the presentation, please type them into comment box. Now, without further ado, we will start the session by inviting our today's speaker, Mr. P. Tirunagalinga Pandyan. Sir, please.
Thank you, ma'am, for your wonderful introduction about me. And respected Principal Dr. Sivar Subramaniam sir, and respected all the faculties of Newton College of Nursing, and all the students and all the administrator of university. Really, I proud to be a presenter in this afternoon session because Gujarat is a land of my hero, the father of nation, Mahatma Gandhi ji. So really, I very happy to be a presenter in that holy place. Now move on to my topic, autism. Really, as Principal sir told, the autism is a very vital and needed topic at this stage or at this time. So before going to the topic, just introduction regarding that child developmental areas. So major developmental areas in children are motor, cognitive and social. So motor is related with the gross motor and fine motor activities. A child crawl before sit, and sit before stand, stand before walk, and walk before run. These are the motor activities. These activities are developed through this motor development. And the second major area is a cognitive. It relates with intellectual activity and also some creativity of the children. An early period, there is a sensory motor intellectual development, then pre-operational 2 to 7 years, and 7 to 11 years after that formal concrete operational, then move on to the formal operational. Then another major area is a social. It's very important. Human is a social animal. He can't live in separate nature. He has to mingle with the society and interact with the society. For this purpose, social development is very essential. The child has a social smile at the age of 1.5 months to 3 months, very early. The social development is started at third month itself, then have a certain language, whosoever, single sentence and so multiple sentences, and maybe some conversation through this social development. So when the impairment in motor development, that condition is called cerebral palsy. As I already told, here the gross motor and fine motor activities disturbed. That is called cerebral palsy. If the cognitive development is disturbed, it is called mental retardation or intellectual disability. So now you can easily understand the autism. The autism is a impaired social development. Here the child social interaction and social communication is impaired. Then move on to the definition. As we already told, autism is a impaired development that is manifest before the age of 3 years, characterized by abnormalities of social development and communication and a restriction behavior and interest. So, as I already told, the child social smile is occurred at the age of 3 months. Here, after within the 3 years, we can easily find out the child is not mingled with the other children and may have certain aloofness and maybe isolated from that peer group. That condition is called autism. The word autism derived from word auto, means locked within themselves. The word autism first described by Leo Kanner in 1943 as early infantile autism. Then Loretta Bender first used the term childhood schizophrenia. You know, the schizophrenia is a condition of that is disturbance in thinking, emotion and volition in clear consciousness, usually leads to social withdrawal. So because of this social withdrawal, Loretta Bender used the term childhood schizophrenia for childhood autism. Move on to the prevalence of autism in India. In India, every 2 to 6 children out of every 1,000 have autism. Boys are 4 times more likely to be diagnosed with autism than girls. The prevalence rate of autism in India is 1 in 250, and currently 10 million people are suffering in India by autism. It is estimated that worldwide about 1 in 160 children affected with autism. The term autism was changed to autism spectrum disorder in 2013 by American Psychiatric Association. The autism spectrum disorder is now an umbrella term which covers the following conditions. There are three or more conditions and collectively called as autism spectrum disorder. One is autistic disorder, that is called autism, and pervasive developmental disorder, which is a common term for developmental disorder with include a lot of developmental delays, and Asperger syndrome. These are commonly called autism spectrum disorder. Asperger syndrome is the children do not have a problem with language. Here the IQ, I mean intelligent quotient, may be the average or above average in Asperger, but the child loss is social connectivity, social communication and social interest or social interaction is decreased in Asperger syndrome. The type of autism spectrum disorder have certain 5 subtypes. Maybe autism with or without intellectual impairment is first types, and second type is with or without language impairment, and third may be associated with any medical condition or genetic condition. Maybe child have any medical problem, nephrotic syndrome and other things, or any genetical issues. Or fourth is associated with any other neurodevelopmental disorder like autism with spina bifida and any mental or behavioral disorder. Maybe autism with catatonia. Catatonia is a disturbance of motor behavior, maybe excitement or stupor. That is a condition. Maybe the autism may be explained in form of some subtypes. Risk factors for autism. So autism, the risk for a child with an old parent has a high risk of autism. Sometimes it is called refrigerator parents. the parents have no warmth, or patient not give much more attention to the child, that parents called refrigerator parents. That parents children are more prone to autism. And pregnant women who are exposed to certain drugs or chemicals like alcohol or anti-seizure medication, especially valproic acids, are more likely to have autistic children. Other risk factors include maternal metabolic conditions such as diabetic and obesities, and untreated phenylketonuria. The phenylketonuria is a condition of that is a inborn error metabolism, which is occur due to absence of enzyme phenylalanine hydroxylase enzyme, and the rubella and others are other risk factors for autism. And major causes are genetic factors. Several different genes appear to be involved in autism spectrum disorder. For some children, ASD can associate with this genetic disorder such as Rett syndrome. Rett syndrome is another pervasive developmental disorder. It commonly occurs in girl children. Here, the child social development, maybe language or other hand skills are developed in early childhood period. But later, more than after 12 months, a child lost her already learned skills like hand skills, writing skills, or speech skills. And head growth also declining in Rett syndrome. This is called Rett syndrome. Another one is a fragile X syndrome. It's a condition of chromosome abnormality which is present with some intellectual deficiency. For other children, any genetic changes may increase the risk of autism. Environmental factors, any viral infections, commonly the papillomavirus and other virus causes for infection, any medication during pregnancy or any complicated pregnancy or any pollution in the air may be triggering the autism in birth. Another one is the biochemical factors. 1/3 of the children with autistic disorder have elevated plasma serotonin. So serotonin is a neurotransmitter, otherwise called 5-hydroxytryptamine. It's a neurotransmitter. If it is elevated, it is one of the causes for autism. And perinatal factor. During gestation, any abnormalities in the pregnancy, any maternal bleeding after the first trimester, any meconium stained amniotic fluid may be reported the history of autistic children. There is also high incidence of medication usage during pregnancy. The mother is a cause for autistic children. Various, ma'am, can you hear my voice? Ma'am, it is audible? Madam?
Audible only.
Yes. Okay. Can I continue, sir? Continue, madam?
Yes, continue.
Okay. Then pathophysiology or pathophysiology of autism, there is the exact pathophysiology is unknown, but various hypotheses are present in formation of autism in children. Here the famous, this one is another hypothesis, that is autism caused by alteration of brain development, maybe due to some genetic factor or any drugs during pregnancy or any other environmental factors which induce during conception causes abnormal alteration in the brain development. So that just after birth, the brain of the children with autism tend to grow faster than usual, and it is followed by normal and relatively slow growth in childhood. So this causes significantly increased number of neurons in the autistic child, so that they impair the process of shaping and fine-tuning of neural circuit. When this neural circuit is disturbed, then the transmission, nerve signal transmission is disturbed. This causes autism. Then we move on to the clinical features of autism. Commonly we are called as autistic triad. Triad means 3 impairments. So one is the impaired social interaction. Another one is impaired social communication and impaired social imagination. Here the language, communication, behavior, social interaction is disturbed. impairment of social interaction. The symptoms are poor relationship with other. That a child may not make a relationship with other. Socialization of the children is disturbed. Socialization is a process of learning norms of the society. This will affect in autistic children. So the child goes for aloofness, autistic aloofness. Aloofness is that is a separated. Maybe they not mingle with the others, ignore the caregivers. That is called aloofness. And inability to handle their own emotions. They can't control their laugh or crying, and avoid group activities. Child is always in a solitary nature. They are keeping themselves in a separate lonely places, and lack of eye contact, and not looking at or listening to other people. Even peer group or even playmates, they not look other children. Dislike being touched or kissed. Maybe the child hate kissing and loving hand of mother and caregiver. No separation anxiety. Child may be in a separate place for a long time, and being left in an unfamiliar environment with strangers. So it will not affect the children. No or abnormal social play. Yes, the play of children is at the early period. A child is an onlooker play. When mother lap, in onlooker play, it converted to solitary play. Solitary play in infant period. A toddler, it goes for the parallel play with other toddler, parallel play. Then preschool children move on to the associative play. That is a mingle with the other children and maybe association and doing play, associative play. And in schooler, they are doing some cooperative play, which is having some captain or other certain role of certain identity role is present in certain play group. That is called cooperative play. So this type of play development is disturbed. Style is stagnated in solitary play only, which is indication of child is an infant. Solitary play, the preferring playing alone only, failure to play with the peers and unable to make friends. And impairment in school communications. Here the exchange of ideas, exchange of words, and exchange of thinking, and exchange of emotion to others or other children or primary caregiver with primary caregiver or family member is affected. So abnormal delay in language development. So usually child language is developed by age. So it attained who words around 5 months, and maybe the mama, dada, this type of word at 5 to 6 months, and monosyllabus and bisyllabus and single sentence and large sentence and complex sentences, and by using some conversation. These are the stage by stage of language development in children. But in autism, the child language development disturbed. The child may not attain the particular language stage at a particular age. Limited or no speech. Fail to respond to his own name. If all we know, the best music in the world is our name. I may not respond to music to some A.R. Rahman song, but I can immediately respond to my name. Somebody is calling Tirunelveli Pandian in street, just I turn immediately, because best music in the world is that one man name. Here, the baby, autism child fails to respond to his name. The difficulty in using or understanding verbal or non-verbal language. So if you call anything, the child cannot understand. Even cannot follow some digital signs, symbols. Repeated or babbling of same words, that is called echolalia. If you ask the child, do you want a drink of water? We expecting the answer yes or no. But the child verbalize the same word. Do you want a drink of water? This is a clinical signs of autism in children. That is repeated babbling of the same words. And inability to initiate conversation with others. If you ask anything, the child may not ask any questions or other things. The child can't creating certain conversation with in front of persons. inappropriate or no variation in voice tone. The voice tone also in same. They speak with abnormal tone or rhythm, or may use sing-song voice or robot-like speech. Don't express emotion or feelings. And impairment imagination. I mean thought process. I mean perform repetitive movements such as rocking, spinning, and hand flipping. Just shaking the hands, just shaking the head, just rolling in their body movements. Perform activities that could cause self-harm such as biting or head banging. Maybe bite themselves or nearest person. Maybe hitting the head in solid surface. That is called head banging. Unusually sensitive to light, sound or touch. Make a loud noise for a bright light. Or may not recognize for excessive sound. Or may not recognize for any temperature. Any or touching sensation. And then fixate the object or activity with abnormal intensity of focus. A child is fixation in the previous stage of development. And add a specific food preferences such as eating only the few foods only. May not have a certain experience on new food. Difficulty in thinking in abstract terms. Child is only thinking in concrete one. There cannot, for abstract, they cannot create and send general ideas, general opinion. They think they beyond their limitation, they can't think or imagine anything. They inability to imagine the certain situations, whether it is a raining season, or whether it is a cold weather, or whether it is a calm place, whether it is some crowded places, that is, they may not imagine the situation. The limited set of interests. Child have no any wandering tendency, not asking anything. The limited set of interests. These are the. So they now gives a certain pictorial form of clinical features. Child is having hyperactivity and prefer to play alone. That is called solitary play. Intolerance to sound and build in the object and a ruler, and no eye-to-eye contact, and delayed speech development, and depression, and rejecting hurdles, and sleep problem. These are some of the clinical features of autism. Diagnosis. How can we diagnose the early diagnosis is very essential to cure or manage the autism. So, I already told the social smile is attained by 3 months, or some child may start with the 2 months. So 2 to 3 months, a child may respond, attain the social smile. But in autism, does not respond with a smile or happy expression by 6 months. Child may mimic sounds or facial expression giving by 6 months, but does not mimic sound or facial expression by 9 months. Child produce who words or babbling by 5 months, but autism child does not babble or who words by 12 months. The child may give a gesture such as point or wave by 8 months, 6 to 8 months. It does not gesture such as point or wave by 14 months. Child may use a single word in 9 months, 9 to 12 months, but does not say single word by 16 months. Child may play or make a believe or prompted by ordinary child by maybe 1 year or maybe 8 months. But here by 18 months does not play or make believe or pretend by 18 months here. Does not say 2-word process by 12 months, but normal child can praise the 2 words by 1 year. Child may loses language skill and social skills at any age. These are the diagnostic features of autism children. If we can find any of the above following in the child early period, we can immediately report the pediatrician or child psychologist. These are the DSM-5 autistic diagnostic criteria. DSM means Diagnostic Statistical Manual, which is given by American Psychiatric Association. 5 autistic diagnostic criteria. Number 1 is a persistent deficit in social communication and social interaction. I already told this, man is a social animal. He has to interact with the society. He has to communicate with the society for anything, for live a life in smooth manner. But here there is a deficit in social communication and social interaction. For example, reduced sharing of interests or emotions, failure to initiate or respond to social interactions. The child or a person of autism cannot interact with anybody. And second, deficit in non-verbal communicative behavior used for social interaction. We have signs of certain non-verbal communication, maybe the facial expressions or digital hand sign, certain symbol. It is a poor in autistic children. And deficit in developing, maintaining and understanding relationship. Child may not make a relationship with family members or friends or playmates or other groups or near neighbors. So may not develop any social relationship. And second one is a restricted, repetitive pattern of behavior, interest or activities. Stereotyped, repetitive motor movements, use of object or speech. Example, simple motor stereotypes, lining up the toys in a table regularly and flipping the objects. And echolalia means repeating the word. Examples of stereotypic movements are given: waving on hands and head banging. I mean hit the head in solid surface, and compulsive picking of on skin, and nail biting and picking of hair. I mean trichotillomania. These are the examples of stereotypic movements. Highly restricted, fixated interests that are abnormal in intensity or focus. Strong attachment to or preoccupation to unusual object. Child always engage with certain activities, may not interest with other things. The child is fixed on certain places. Hyper or hyporeactivity to sensory input. Their visual, their hearing, their taste, their smell, their temperature, their skin surface, all are maybe hyper or hypo. Apparent indifference to pain or temperature. Maybe a child responds to pain in a very high manner or not able to respond to pain, or a temperature likewise. Adverse response to certain specific sounds. Some child crying for certain sounds, may not want certain sounds, need calm place. So excessive smelling or touching of objects and visual fascination with the lights or movement. Then symptom must be present in the early development period, maybe within 3 years. See, we can easily find out the autism feature within 3 years. Then problem with social, complications of autism. If the child is having autism, what are the complications have to met by that child in the society? The problem in school with successful learning. Maybe the child may not enter into the ordinary school. Child needs special school for learning. Employment problem. Likewise, the child may not enter into the job as a normal person, because they cannot interact with anybody nicely like others. Inability to live independently. Some child need depend others for some work. And social isolation. Always the person of autism in isolated manner. Stress within the family and victimization and being bullied. These are some of the complications of autism in children. Then management of autism. Autism management. There is no cure for autism. No cure for autism. But autism can be managed by some therapies. The goal of treatment is to maximize your child's ability to function by reducing autism by symptoms and supporting development and learning. Early intervention during preschool years can help your child learn critical social communication and functional behavior skills. So we have to train the child in certain area in special schools or in special therapies by early identification. So behavior therapy is a best choice for managing the autism children. The common behavior therapy used in followed in autism children is applied behavior analysis. They are using the behavior techniques of cultivating new behavior. For this purpose, they are using the behavioral technique like shaping, modeling, chaining, token economy, and positive reinforcement. That behavioral techniques are followed by the therapist. These are the applied behavior analysis therapy by the therapist. They are understanding the ABs as applied behavior analysis. They are developing the new skills by positive reinforcement by reward for successful thinkings. And educational therapies. Children with autism spectrum disorder often respond well to highly structured educational programs. Successful programs typically include a team of specialists, variety of activities to improve the social skills, communication, and behavior. Preschool children who receive the intensive individual behavior intervention often show good progress. So you have to start the intervention in early period. I mean preschool period, 3 to 6 years. You have to start the therapies to the autism child. It will give a good response. And family therapies. I mean parent, other family members should learn how to play or interact with the autism children. And promote the social, how to promote the social interaction skill and manage the problems and behaviors of autism children and teach daily living skills and communication. So parents and family members has to trained to manage the autism child. And other therapies involved depending on child needs, speech therapy to improve the communication skills, occupational therapy for older children, activities for the daily living, some of the therapies, and physical therapy to improve the physical movement and balance may be beneficial. And medication, no medication can improve the core sign of autism spectrum disorder, but it can be control the symptoms. For example, antipsychotic drugs, haloperidol, helpful in decreasing hyperactivity and to treat severe behavior problems. Antidepressant drugs, I mean thymoleptics, may be prescribed for anxiety. And fenfluramine is a amphetamine drugs. It is a sympathomimetic drug. It stimulates the central nervous system and useful to reduce the motor symptoms and improve the social relations and attentions. Naloxone and naltrexone is a opioid and agonist drug. It decreases the stereotype behavior. Prognosis of autism. So what is the prognosis of autism is about 10 to 20% of the autistic children begin to improve between 5 to 7 years of age. Next 10 to 20% can live at home but need to attend special school. 60% of the autistic children little and unable to lead an independent life. Yeah, some of the voices are disturbing. The legal rights of the autistic children. So, autism children have certain legal rights. Person with a Disability Act 1995 and Mental Retardation and Multiple Disability Act 1999 give certain safeguards and rights to autistic children or autistic individuals, like right to education, a right to equality, a right to live, and right to freedom. These type of rights are given this act. Legal safeguard is available for autistic children. Under Income Tax Act 1961, tax benefits are available for parents or guardians of autistic children. 75% concession is available for railway ticket for autism children and their escort. And Ministry of Social Justice Empowerment launched a cashless health insurance scheme, Niramaya, for autistic children. Last, we move on to the certain care activity for autism children by the nurse. Early diagnosis and referral. As a nurse, we have to identify very early during immunization or during any hospital visit or during any the first when you may school health program. You have to identify the or any after the Palwadi nutrition program. You have to identify the artistic feature at early and refer to the higher center or for pediatric neurologists or speech therapists or psychologists or occupational therapists, certain for counseling services for diagnosis and further management. A personal care, another important role to guide about self-care, hygiene and safety. And autistic children and the caregiver has to train to manage the children for self-care and hygiene and safety. Provide encouragement and positive reinforcement to the child at the primary caregiver. Implement the basic nursing intervention to decrease the anxiety and pain to optimize the quality of care. Education. The family and siblings may be educated on various aspects of autism and autistic disorder. You have to educate the family members and siblings how to move with the autistic child and give the nature of the disease. Just give the knowledge regarding autism child symptoms and any treatment option, expected outcomes and available support resources. These are all those things as to inform to the family members and siblings and other caregivers of autism children. And arrange the healthcare visit. As a nurse, we have to arrange certain healthcare facilities for the autism and the parents of autistic children. We have to give directions of the better options for the counseling center, better option for the behavior therapy center, speech therapy and occupational therapy. As a nurse, we have to help to identify the good center for care of autism children. Maybe help in attending special school. Nursing intervention on autistic child at a special school. Care at a special school require knowledge of the disorder, patience and much creativity. Assist with the feeding, dressing, toileting and first aid. Regular nursing care is required to make these children cope up with society. So finally, we are moving to the nursing diagnosis. Risk for self-mutilation related to neurological alteration. Child is have neurological alteration, so risk for self-mutilation. Child is inability to trust other because of the disturbance in the social interaction. So impaired social interaction related to inability to trust others, and impaired verbal communication related to withdraw into self, and disturbed personal identity related to delayed developmental stage. Child may not attain the normal developmental stage. So disturbed personal identity. These are all of those nursing diagnosis of autism children. So the United Nations has announced 2nd April as a World Autism Awareness Day. From 2012, every year it gives a theme. This year theme for Autism Awareness Day theme is inclusion in the workplace, challenges and opportunity in a post-pandemic world for autistic children. These are this is the this year theme for Autism Awareness Day. So autism child is always unique, totally interesting, sometimes mysterious. Yes, see, there is another one condition is called a idiot-savant syndrome. So idiot-savant syndrome is a condition, is a group of symptoms common in child with autism and other pervasive developmental disorder. Idiotic savant syndrome means, and because of this developmental delay and because of this social development impaired, child acquired certain potential, peculiar talent. So child is maybe a very talented in drawing, maybe very talented in certain activities, maybe talent in certain invention. See, world famous uh, famous persons, many persons are autism person. Albert Einstein is a physics legend who found E equal to mc square. He is the autistic child. So many person in maybe some of the pop singer, one person is autism. Uh, so many autism persons are legend in certain field. So always they are unique and totally interesting, sometimes mysterious. And finally, take home point for autism. Autism is a disorder of social development with a triad impairments of, that is a social integration. The child may not integrate, maybe may not interact with the society or social member or the peer group or neighbor or playmates. And communicate, this impairment in communication. Child have a disturbed in communication, speech, disturbed in conversation with others. A child the impaired imagination. Child may not generate ideas. So early diagnosis, even though it has no cure, but early diagnosis and intervention is essential for autism children to lead a life in successive manner. So autism children have legal rights to get education. So always we appreciate the autism children. We should give much care to the autistic child. We should protect the autism child because they are one aspect only, they are impaired. Other two things, motor and intelligence, is very normal in autistic children. So my heartiest and sincere thanks to administrators of university and principal sir and HOD, head of the department and faculty of pediatric nursing department, Newton College of Nursing, and especially Madam to give the opportunity to me. Thank you one and all.
Thank you for this necessary information, sir. Now we will go ahead and take some time for questions now. Just reminder, please be sure to type your question into comment box. So starting with the first question, sir. Why it is hard for people with autism to communicate?
Yeah, why it is? Because the neural nerve terminal synaptic area, which is essential for the language and the communicative development, is disturbed. So that the particular area of communicative interaction imagination area is disturbed in autism.
Sir, when autism spectrum disorder can generally be diagnosed?
Yeah, within 3 years of the children. We can nearly, when social smell usually occur in children around 3 months. If child is not attaining social in 3 months, we have to pass years and wait for some time. Maybe it will attain in 4 months. Maybe if child beyond the 1 year may not be some social interaction or social smile. It is a face-to-face contact with the caregiver or the parents. It is a chance for the autism.
Sir, last question. What are the early symptoms then we can identify, sir?
Yes, sir. Babbling and hoovers and social smile missing and smiling of mother face, and maybe the hoovered and babbling is missing. Sometimes the child is babbling within the swing, in the swing within 6 months. That is missing in autism child.